Rahim. First of all, I would like to extend my deep gratitude to the Chess Society for inviting me for this talk. It's always a pleasure, and what we have learned out of COVID. But मैं अपनी ये talk ये कह के इब्तिदा कर रहा हूँ कि दीवारों के यकीनन कान होते हैं, कोई तो सुन ले. I think this post-lunch session is always difficult, because I think we have set the priorities in a different direction, and that's a bit unfortunate. Aman, let's get back to the lovely audience that is sitting in front of me. And COVID has been a big challenge, and for years and years we have been talking of so many eventualities. We used to hear about the influenza 1918, 1958 pandemic wiping off more than World War I and II, and we were expecting some influenza pandemic down the line with a combination of maybe bird, swine, and animal varieties. But we were just caught up, the whole world was caught up in a different virus, that was coronavirus. I truly believe that such challenges do bring in opportunities, and it is our job to convert those opportunities into realities. I think it's basically not only establishing, but strengthening, but saving the humanity. That's the main purpose. That's the purpose we are here. The new, I think, topic that is getting up is the global health security very rapidly, and I mean, I can talk a lot about this because this has been my passion. We brought Pakistan after the post-COVID to international steering group of global health security, alhamdulillah. And in 2023, with the backing of two main developed countries, we were elected as the chair of this global health security. So that shows the working that was put in during the challenging times of COVID and how it translated into activities and how we moved on. But we remain concerned because the emergence, re-emergence, biological threats, you keep hearing these terms time and again. So all comes under the umbrella of global health security. And why? Because globalization. An infectious disease threat anywhere is an infectious disease threat everywhere, 24, just down the line, 24 hours. And you have the example that how on 31st, we had the first reported case to WHO, and within 10 days, China reporting the death. And then within next 2 months, it was declared as a pandemic. And all of you are witness. So what have we learned? How we are translating again into our... I will just, I mean, it's such a huge tasking that was there as not only as the head of, but I was chairing so many committees and being part of the National Command and Operations Center. I think that set momentum for working and strategies at the national level involving all the stakeholders. So this NCOC, you must have been seeing on a daily basis on the television and social media. It was established to resolve all the issues and make uniform policies with uniform implementation, and I would say stringent implementation on grounds in so many institutes, stakeholders. And for the first time, I think private sector was totally taken in hand. And I think that was one of the key. And this topic is now being talked at international level as well. And at the international level, I mean, they have not forgotten COVID. I mean, even this evening, I'm leaving for Indonesia. There's a meeting by GSAID, which is the global initiative for influenza-like diseases, and it's a 2-day meeting, and even the next week there's another meeting following that in Abu Dhabi. So there's a continuous momentum, I think, and that's what we need to activate at our end, so that whatever we have learned should be put into implementation strategies for the future. But I would say it was all a centralized approach involving all the stakeholders, as I said, and starting from public awareness to the policies and meaningful policy and policies which were actually implementable on ground. It's at times very easy to make long documents, but I think implementation is the key to success. That's where we got the success at the National Institute of Health and NCOC level. And some of the strategies that I think we evolved as globally very much appreciated was the smart lockdown. I'll be talking a bit. So you would have been seeing these on the daily basis, and it just narrates how methodical the approach was. And if you see deep down, we have what happened and how it started coming down, and the 6 waves and the different variants, and the morbidity associated with that. Now, what that indicate, if you see the green color, is basically the recent testing at that time from each country. And again, Pakistan was doing the same day. And you are all witness, I mean, how rapidly we evolved. I still remember that the first kits that we received, we sent a special plane to China for doing the PCR testing and all that. We ensured the quality assurance with NIH, and then we dished out to certain private centers as well as certain public centers, very few to start with in the country. And what was the outcome? Basically, the first wave, we just had more than 300,000 cases and less than 7,000 deaths. And similar in the second spell. And this was the thing which was highly appreciated. The BMJ person is sitting right in front of me, and so it's been appreciated by WHO, by Dr. Tedros. You name people. Bill Gates was here. We represented him as well. And so this is where you come up, where the country or the international community requires you. Surveillance. We have done a lot for surveillance. Even before COVID, I think we were prepared with the integrated disease surveillance and response system with 55 districts that have been integrated into the national hub. And we moved on in a very consolidated manner. And this term you might have heard, that the TTQ, the tracking, testing, and monitoring, which is a key success, and most of the countries adopted them. There was technology integration into this one, so that things were available on the apps, even for the doctors, for the staff, tracing it out. And coming down, picking up the cases where were actually located, and this led to the strategy of mini lockdowns or micro lockdowns or smart lockdown strategy that again other countries started adopting once we did at the national level. And even contact tracing, if you see Pakistan in the early days, very rapidly, we had a very comprehensive tracing system. I still remember for the first case that was announced, and I was giving a talk at LUMS on artificial intelligence at that day, that I got a phone call just before my talk that NIH has picked up the first case. We traced 227 people against that one case. It was a very high ratio initially, but definitely as the cases started increasing, the contact traces remain compatible with the international standards. Diagnostics, I think, was the backbone, and as I said, the first testing started in NIH. We raised our capacity, we started training. Not only that, there was deficiency of the transport medium. We started manufacturing it locally, and you can well imagine how many labs from the public sector and the private sector, 147, 93 and combined. And this chart actually was right on my table, and I was maintaining in myself. And we had a quality control training, biosafety training side by side, so that there is no outbreak within the labs. And you can well imagine, as you can see the map, we had the public health lab, which were established just before the COVID, and then there was a system throughout the country, which helped us a lot. And this is the testing tracing policy. Again, you can see Pakistan falling with testing with anyone in the symptoms could come and get the testing done. One of the key successes, because before the COVID, we used to send the genomics sample abroad, mostly to other countries for whole genome sequences. But alhamdulillah, we could fetch a grant from Gates Foundation, and we established the first ever genomic center. We started off with viral and COVID, and we were very successful, and we started integrated into the international level. And this is the meeting that I'll be attending tomorrow, inshallah, in Indonesia, that how to come up with one health concept as we move on. हम ये concept अब आप सबको मालूम कि health साझी है, चाहे जानवर हो, चाहे परिंदे हों, चाहे पौधे हों और इंसान हो. So this is the concept of one health where we working together. That is your part, I think. Hats off to you and all other dedicated doctors, specialists, paramedics, nursing staff, how devoted they have been. Within no time, there was an enhancement in the hospital capacities. Even going down to the level, we started producing oxygen massively because there was a shortage in the early days. We did talk about hospital infection. And to the best of our knowledge, very few sporadic cases of hospital infection. Otherwise, it was very well controlled. And I think, as I said, challenges, bringing in opportunities for the first time, ventilators, personal protective equipment, they were all manufactured within the country. Now, this is one great example. Within 40 days, this hospital, based upon the Chinese model, was established within the vicinity of NIH, and I remain involved throughout it, this one. And it's a basically modular hospital which can be utilized for the infectious disease. That was the plan, to keep utilizing. Yet another key area, I would say, we, in the initial days, we started hearing about the herd immunity and all that. So I would say no one is safe until everyone is safe, and that safety was brought in by the vaccine. But it depended on availability. There were countries which were like Canada, which have booked 5 different vaccines for the total population. So if one failed, the second one they would get, and it was a huge debate at international level. And I, being part of the COVAX, that is the WHO body, also working with the Gavi board as well as member. So I think the strategies, you have to really put forward your view and get the things at the internet. So for the first time, we created a very comprehensive policy, the national immunization, job sabko, ab apne cards mile, or everyone was bothered because mobility and all depended upon and those cards. Centers were established, and we started procuring, we engaged different companies. And for the first time, I think this is yet another success story. Bringing Tayyiba sitting here right in front of me, and it's always a pleasure to get in touch with youngsters. We brought the first ever phase 3 clinical trial to Pakistan. Alhamdulillah, I was the PI. It was an adenoviral-based CanSino vaccine. But what I did with the Chinese side, I totally narrated directly it with the transfer of technology. It was not easy. And I used to tell the government and my seniors at that time, people don't work here. And what to talk of accepting challenges within the challenge. So we did that, and finally we manufactured 220 million, 2 crore doses of CanSino at NIH. And this was a newly placed facilities which we completed just before, and we just converted into. Now, based upon this, yet another success story for Pakistan was that there were 5 countries which were to be picked up for messenger RNA technology. And this is the latest technology for Moderna and Pfizer. And Pakistan and NIH were selected. And alhamdulillah, our teams have been trained at different fora. And now I'm also in the Global Council of IVI Institute, which is the best institute now working on these. So these are the successes. And you can see, this was no less than, I've seen a number of international centers and vaccine production facilities, and it is no less than anyone globally. I think one of the, yet another good was the uses of artificial intelligence in the best possible way, the data collection, the data analytics, different apps that were, and Pakistan was rated among, I think, again, appreciated for utilization of telemedicine. Again, we were among the pioneer countries, and this example I've seen being quoted at the global arena a number of times. So talking of, just giving you a few examples, emergency response, picking up the GPS system, locating the nearby hospital, even going down to the level whether the bed is available or not, and different ambulance sources and all those. So it was all done through utilization of data analytics and utilization of artificial intelligence. And we kept them, and we finally, what happened was that we, as we moved on, we transitioned all the things from NCOC to the National Institute of Health. I would say, I think, quality research, I feel very privileged. I think we had more than 70 publication in the peer-reviewed journal that include Lancet and BMJ and what not, topmost journals from Pakistan, alhamdulillah. And for the first time, we started and initiated the concept of high-level research, not only the gene sequencing, but going down, deep down. One of the key things was the environmental, because we were again among the pioneers when we thought that we were already testing polio in the sewage water. And I gave this idea to my team, that let's try for the COVID. And we were so successful, and that this methodology has been adopted. This methodology was later adopted for the planes as well. Rather than testing every individual, you take out the wastewater and test for the present. Now, so these have been things which we have been doing in collaboration at international, with international institutes, and side by side, being part of the Health Research Institute that came down under NIH, higher education, where I was the co-chair for the biological sciences. We ensured that the grants are given in this dedicated area of field. We ensured the population-based study regularly at NIH, and as I just explained, this example that we set for the environmental center, which has gone down internationally, and coming down to international research with different academic, which has already been published, like lipid mediators, their role, coming down to antibodies and how they can work together. So these are the things that set forth a momentum for getting up research within the country. So what was the outcome? Basically, the transition of NCOC, it is still there, it is active. जब सैलाब आए थे during the inundations, we again coordinated with all the provinces and gathered the data. So these are the example. I hope, I'm not there anymore, but the things continue in the same momentum. And not only that, with the new act, we established this CDC for Pakistan and Center for Genomics, as already said, first ever health data informatics center as well, and Center for Occupation and Patient Safety, which never existed in the country during that crisis period. And then moving on to the Emergency Operations Center, not only at NIH, but moving much beyond. And we did procure 4 mobile labs, that 3 of them have been donated to the provinces, and the 4th one, it's a fully furbished. And we were going down to the level where we had trained the teams and we have the equipment of handheld genomic devices. So these are the very new techniques that we adopted successfully. So what were the successes? You all know, I mean, timely and appropriate response, international recognition, so much of collaboration, quality research, procuring international grant, local production, as I said, messenger R&D. And again, if you talk of vaccination, we had more than 90% vaccination rate complete vaccination 12 years and beyond. This has never happened in Pakistan previously, and that's a huge success. And for the partial, we were approaching almost 94%. Another thing for which even all the international stakeholders like Gavi, they started giving us vaccines to utilize. So I mean, just to I think finish it off, challenges and opportunity. It's our job to maintain those that balance, which can really wipe off not only COVID, but so many other things. And let me assure the younger generation, we have all the capabilities provided we are sincere. Zara nam ho or zara gham ho, to mitti bahut sarkhez aisa ki. Thank you so much.
Thank you very much, sir.